Because I'm ready to mobilize, and ask your neighbor if you're ready to vote, because I'm ready to vote. Ask your neighbor if you're ready to knock on those doors, if you're ready to have those hard conversations, whether it's with family members, whether it's in the workplace. Ask your neighbor if they're ready to unionize their workplace. Ask your neighbor if they're ready to fight. To McDonald's, to corporations, is for them to get off of welfare and start paying their workers a living wage. Taxpayers of this country are tired of subsidizing a multi-million-dollar corporation, subsidizing this corporation.
Okay, we are live. Good morning, everyone. Welcome. I know it's bright and early, and there are so many of you who wanted to see this stream and see this conversation. So I welcome you here. I hope everyone is having an amazing Thursday morning. Boy, have this week gone so fast. So the first thing I want to say is I'm glad to have everyone here to do this stream, where we will discuss vaccine hesitation. And how we address that issue. But before I do that, I would like to give some brief campaign intro updates. The first being that we are nearing our end of the month quarterly deadline or monthly deadline for fundraising. So if you have not been able to do that, I am encouraging you. I am hoping that you will be able to do that by visiting the website and going to our AppBlue link and giving anything you could, rather that's $5, $10, $25, $100. Whatever you can afford. Campaigns are expensive. They cost a lot of money, and we really need this leadership here in Florida. Quick updates, other updates that we might have. So far, we're going to have a series of events within the district and throughout the Broward County area. So if you're interested in that, then keep your eyes on our website and social media for some of the updates that we're going to have regarding that. So now we'll get right into the program. And I want to first thank everyone for their interest. I know so many people had the idea of having some sort of event like this, a stream. And this is the first stream I've done for the campaign so far. A stream on the COVID-19 series, a COVID-19 series, and a stream regarding the vaccine and hesitancy. And a couple of you have reached out and asked that I do this. So I wanted to do that. And I have a special guest here today that I'll be introducing and bringing on to the stream. So we are live on multiple platforms. So if you can't stay on Facebook, then you can go on YouTube, you can go on LinkedIn, you can go on Twitter and listen in. So I'll go ahead and start introducing him, and then I'll let him introduce himself, and then we'll get right into the program. So bear with me. And thank you for attending. So first, I'm just going to bring him on the screen. Good morning.
Good morning. Can you hear me okay?
Yes, I can.
Perfect.
Okay, well, I'm gonna let you introduce yourself, because I think that you're probably the best person to introduce you. I know we haven't spoken before the stream. I know I wanted to do that, and we didn't have the opportunity to do that. So I'm going to let you introduce yourself to those that may be watching and those that will be watching soon. And thank you for coming on too.
Yeah, of course. And Elijah, thank you for having me on. I think this is a really important conversation to have, especially in the midst of what's happening in Florida and the rest of the nation. So my name is Chidi Akusobi. I am a 8th year MD PhD student at Harvard Medical School. I was born in Nigeria and grew up in New York City in the Bronx. And afterwards, I went to Yale for undergrad, where I studied biology. Then afterwards, I went to the University of Cambridge in the United Kingdom in the UK, where I got a master's in biochemistry. Then after that, I came to Massachusetts here in Boston and started my MD PhD degree. I completed my PhD in infectious diseases last year, so I wrote my thesis and defended. And now I'm in my final year of medical school and am applying to residencies. And in general, I'm really excited to be here and have this conversation. I have been doing a lot of talks and panel discussions surrounding COVID and the vaccines. And the more that we can empower people with information about these, about the pandemic and about the vaccines, the better off we'll all be. So thank you for having me.
Absolutely, I appreciate it, and that's a lot. And I know last year has been a very interesting and troubling year for a lot of us. I've had COVID-19 twice. The first time, I'm really surprised that I even made it the first time. It was really bad. The second time, I kind of got through it really quickly, and I'm fully vaccinated, so I'm pretty proud to do that. But I'll still be doing my part, wearing a mask and socially distancing, because our state is, going through quite a bit. And how is it where you are? How is the pandemic treating you guys over there?
Yeah, so actually starting tomorrow, Boston is going to reinstate indoor masking policies. So we sort of had a brief time during the summer where things seemed like they were moving in the right direction. Cases were down. We were able to resume indoor dining. We were able to, remove masks now that we're indoors. But because of the Delta variant, cases have been slowly starting to creep up. And also school is starting, and Boston has a lot of universities. Over 50,000 students are gonna come to the city essentially from all around the United States. And so starting tomorrow, we're gonna go back to indoor masking. But that being said, if you look at the data from across the 50 states here, Massachusetts is actually doing pretty good in comparison to states in the Southeast. And that's because our state has a very high vaccination rate compared to the rest of the country.
That makes sense, and it's great that you brought that up, because I want to, go into the numbers. So I'm going to bring up on the screen just a little thing I put together yesterday. So hopefully you all can see this. All right, so I'm just going to go into this. I created this last night, and the data is current up to last night. So I'm just going to go into the stats regarding COVID-19, and what we have here is the global statistics. COVID-19 infections are still rising in 78 countries. There are 213.6 million infections and 4.6 million reported deaths caused by COVID-19 so far worldwide. In the US, we have, and this is the breakdown by country. 150,883 new reported infections as of yesterday in the United States, and 1,104 new reported deaths. And again, these numbers are from yesterday, so this might be a little outdated. And then in Florida right now, there have been 3.1 million cases of COVID-19 and 42,731 deaths. In Broward County, where I'm from, there have been 309,000 cases, 3,079 deaths in this county. And we're averaging about 20 to 30,000 new infections per day, give or take. And there have been 24.4 million doses given and 11.1 million people fully vaccinated. So that's about 51.9% of the population. Globally, 200 countries have started vaccinating people for COVID-19, and there have been about 5 billion doses of the vaccine. That's a lot. And currently in the nation, as of last night, and I have to get the data for this morning, and I'll do that later, there have been 364 million doses of the vaccine administered, 171 million people fully vaccinated, which is about 52.2%. So as we know, Florida is below the national average just a little bit. So I'm gonna transition away from this, and I'd like to ask you, why do you think these vaccination rates are kind of low across the country in general? It's been a couple months since the vaccine has been available, and now everyone is able to get it, but there are still many parts of the country where people have not even gotten the first shot.
Right. So I think when the vaccines were first emergency authorized for use back in December, early January, at that point, the problem that we had was that there's a lot more demand for the vaccine than there was supply. And so many people wanted the vaccine, but because the vaccines were just coming out, were just starting to be manufactured, there weren't enough vaccines at that time to give out. Now we've actually have the opposite problem where there's a lot more supply than there is demand. And that's because we have vaccinated effectively everyone who wanted to get a vaccine, who didn't really need convincing. And now what we're experiencing are people who are hesitant to get the vaccine for a whole number of reasons. And some of those reasons include, some people want a little bit more information about the vaccines before they take them. Some people have questions about the vaccines, rightfully so. There's also people who fit into the camp of being distrustful of the government or of the data or pharma companies. And then what is actually a really big problem now is people who don't want to get the vaccines because they believe in the falsehoods and the lies that have been propagated about the vaccines.
Right.
And so we've sort of reached a plateau where everyone who could be easily convinced or who didn't need convincing to get the vaccines have gotten their shots. And now what we're working on are the people who are hesitant for the reasons that I had mentioned earlier.
Right. So could you explain how the vaccine works, what the science is behind it, for those that may not even understand that?
Yeah, so the vaccines that have been primarily used in the United States are the Pfizer and Moderna vaccines. And those vaccines are based off what we call mRNA technology. These are mRNA vaccines. And so just to take a step back and explain what is mRNA. So mRNA is a blueprint molecule. It's a molecule that tells our cells in the body what proteins to make. And so what these vaccines do is they have an mRNA that has instructions to tell our cells to make what we call a spike protein. Now, the spike protein is found on the surface of the virus that causes COVID-19. And so this protein is what actually allows the virus to bind to our cells and enter our cells and cause infection. And so what these vaccines do, and what they do, pretty well, is that they carry instructions for our cells to make this spike protein, which our immune system recognizes as foreign. It recognizes these spike proteins as something that is not what naturally would be in our body. It's from the virus, and it produces antibodies against the spike protein. And these antibodies are what give us immunity to the virus. And so you get the shot, your body produces these spike proteins that then helps the body create antibodies that give you protection. Some really important points about the vaccines that I try to stress. The first is that this mRNA does not permanently alter your DNA. It goes nowhere near your DNA in the cell. And it's also degraded. And so it stays around for about 1 to 2 weeks, and then it completely vanishes, because that is what that's what the molecule does. And this is research that has been going on into these vaccines for over 20 years. And so it's not that these vaccines came out with like a year or two of research. It's actually, this technology rests on decades of work. And so the vaccines ultimately give you immunity against COVID-19, such that if you are to then encounter the virus out in the wild, out in the world, you have antibodies to protect you against antibodies to protect you from getting infected. So that's how the Pfizer and the Moderna vaccines work. And we've seen from the clinical trial data, but also from real world data, and not only the United States, but countries around the world, that the vaccines are effective. They prevent people from getting sick with COVID, and they're also extremely safe. And so far, over 180 million doses of the vaccines have been given out in the United States alone, and over 5 billion in the world. And so, and the rates of adverse events, what we call things that are like scary, as you would say, is exceedingly rare.
Thank you for telling us exactly how that works. And I read recently that mRNA is kind of new, or it's been mostly research and now is being put into effect. So I want to make sure that's correct too, because I don't want to be
Yeah,
leaving
no, I
anybody.
think that's an excellent question. So mRNA, the molecule mRNA has been studied for decades. So that itself is not new. We have understood what the role of mRNA has been since the 60s and 70s. They were discovered as one of the essential blueprint molecules of life. So you have DNA, which has our genes, and then our genes give our cells instructions, and those instructions are an mRNA molecule. So we've known that for decades. Then research into using mRNA technology for vaccines that research started in the mid 90s by several scientists, including one female scientist, Dr. Kariko, who had this idea in the mid 90s and stuck with it for 20 years. And so
Right.
these companies that have produced these mRNA vaccines, they were actually working on this way before COVID-19. This is something that has been sort of in the background for a long time. It just so happened, unfortunately, that global pandemic arose in 2020 that necessitated that we vaccinate lots of people very quickly. And the mRNA technology, which had been developed for decades, two plus decades, was sort of in the right place, right time to be used.
Right. Yeah. That's a really good point. One of the common talking points I hear from people, online is, why was this vaccine developed so quickly, and why were they researching it too long and stuff like that. And I think a lot of people don't understand that, the need for it arose, and it just shows the innovation we can have in this
Right.
country when we're dealing with any sort of problem that's affecting the entire country.
I 100% agree. I think putting the vaccines in that light is really important. When you have hundreds of millions of people around the world getting sick with COVID, millions of people dying from COVID, this requires, a Herculean effort from medicine, from science, to protect people's lives. And so these vaccines are really in one of the best things that we could have done as a species, one of the best things that scientists and doctors could have done to really protect us and prevent this from becoming a tragedy that last for years and years and years. It's our best tool.
Right. I definitely agree. And I definitely, I was unable to get all of the data for inoculation rates by race and age to break that down today. But, I did read earlier yesterday, that the vaccination rates for the African-American community and certain parts of the country was pretty low. And for young people as well, the vaccination rates were pretty low. Can you explain why you think that is, and if anything, what we could do to kind of increase those numbers?
Yeah. So I think earlier on in the vaccination campaign, those numbers were low because of disparities in how the vaccine was actually being administered to different communities. And so the way that the vaccines were initially set up, where people were on first come, first serve basis, essentially. And people had to basically be really skillful to use these online portals to sign up for the vaccines. They were also given during times where people potentially had to work. Vaccine sites were also placed in communities in some places that were predominantly white or very mixed, and not in predominantly Black and Hispanic neighborhoods. So in the beginning, there were a lot of issues that led to that disparity. Now, I think the vaccines are essentially in the United States. If you want a vaccine, you can get a vaccine. The supply is quite large. And so now the disparities we're seeing is in vaccine hesitancy. The one thing I will say, though, is that at least 3 months ago, a study was done by the NPR showing that the most vaccine hesitant groups, so the people in the United States who are most likely to not get a vaccine, are actually Republican men. And in fact, because of the way that the Republican Party and then people on the conservative side have been castigating the vaccines, we see that there's a lot lower vaccine uptake in a lot of rural white communities. That
Right.
being said, there are still disparities in Black and Brown communities, especially among the youth. And I think that has largely to do with either, not feeling like you need the vaccine. There's, especially among the youth, there's a little bit of a complacency in that if you feel fine, if you think if you've had COVID and nothing really happened, then why get the vaccine? And then the second issue is like trust. And I think there's been, as you probably know, decades of,
Yeah.
or actually centuries, I would say, of historical mistreatment mistreatments that the United States government has imparted on communities of color among Black people. And so I think people have, are rightfully have distrust about with the vaccines. So those are some of the factors I think that could be contributing to that disparity in vaccine uptake. But one of the things that I'm involved with here in Boston is this project called We Got Us, where we actually go to Black and brown communities here. It's a group that is composed of mostly Black and brown healthcare professionals like myself. And we go to these communities, we go to churches, we go to school gyms, we go to community centers, and we actually talk to people, especially people of color, about the vaccines. And I think when you actually see faces that look like you, and you see people who are knowledgeable, but also understand what your misgivings would be, talk about the vaccines, I think we've seen a lot of really good success getting some of these more people on the line to eventually get vaccinated. And I think more needs to be done to actually go to where people are and speak to them face to face and listen to them, answer their questions, and get people better informed about what the vaccines are and what they can do.
Yeah, that's very important. A lot of people probably just don't hear from professionals, or they hear from the media that they're distrustful of, or social media, and they already have their opinions developed around that. And it's great that you brought up the history surrounding experiments on Black and brown people, medical, our distrust of the health and medical field for valid reasons too. And, that's going to be a lot to kind of break through. And, I think a lot of it for young people is one, complacency, like you said. Many of my peers have told me, I don't think I'm going to die, which we now see that's not actually true. You could. This is something that's not affecting me. Why should I get the shot? I'm going to be okay. The only person that's going to die is, older people who already have issues. We know that's not exactly true at all.
Right.
And
I agree. I think especially with the Delta variant now, with this, we're seeing in hospitals that the people who are actually getting hospitalized are unvaccinated folks, and they're tending to skew younger. So early on in the pandemic, you saw a lot of people in their 60s, 70s, 80s being hospitalized. Now we're seeing people in their 20s, 30s, and 40s being hospitalized. I always tell folks, you don't want to roll the dice in your life. You have no clue how COVID is going to affect you, even if you have no other health conditions. And if you do have health conditions, that's even scarier. And so one of the reasons to get vaccinated is to give yourself an insurance policy against being hospitalized and potentially ending up in like an intensive care unit and potentially even passing. And we've seen a lot of really sad stories in different media outlets about parents, young folks who didn't get vaccinated, wanting to get vaccinated as they are living their last moments in life. And by that point, it's too late. And so again, you don't want to roll a dice. You don't know if you're going to be in that situation or not. But what you do know is that if you get vaccinated, you're preventing against that.
Right. And I want to bring up, share my screen once again to show what the hospitals are looking like in Florida. This is a little scary. I kind of saw this last night in the news, and it was showing the ICU bed capacity in Florida. Make sure I'm on the right page. I'm on the right page. No, I am not on the right page. Forgive me, guys. Okay, I'm gonna have to skip that one. But it was showing the amount of beds we had in some counties, and many counties in the state of Florida. There are 0 beds available in the ICU. And in Broward, we're a county of about 2 million people, and there are less than 100 beds available. In Miami-Dade County, there are less than 100 beds available. And we're seeing, I think, a few days ago, there were about 12,000 people hospitalized in the state of Florida. And, there are a lot of reasons for that. I don't want to get you all caught up in the politics, but the politics definitely plays an important role in that.
Absolutely.
Yeah, like a huge role. And we're seeing, not just here in Florida with our governor, but all across the country, people in positions of power downplaying the pandemic, downplaying the role of masks or the importance of wearing a mask when you're in public. In schools now, that's a big fight here in Florida. And, not even promoting the vaccine or trying to help people get access to that vaccine. And instead with experimental drugs and things that are not approved by the FDA. And now we're seeing in Florida that the big problem we're having now is we're running out of beds, and there's no plan to get more beds or, increase the capacity of hospitals.
Yeah, I was actually looking at the Florida data earlier this morning and saw that Florida broke its own record for a number of people who've been infected with COVID in terms of daily cases, and then also people who are hospitalized. It's crazy. And I think one of the issues with this pandemic is that you only really understand its severity when you go into hospitals, emergency rooms, intensive care units, and you actually see people dying. You see nurses and doctors and hospital staff completely overwhelmed with just how many cases of COVID there are and how much work it is to keep people who are really sick alive. And so I think if people, especially politicians, had a better sense of what the actual public health impacts were of this pandemic in terms of real people dying, real people working to save lives, then there would be, I think, a better appreciation for even the simplest interventions like masks or social distancing, not to even talk about, encouraging people to get vaccinated. And so it's unfortunate. And I'm really glad that you brought up that it's in a lot of times a political issue. We have leaders who are in charge with protecting the public and ensuring people's life and liberties, who are doing everything they can essentially to prevent against that because of ideologies that were peddled, back in 2020 under a different administration. So it's unfortunate that this pandemic has been politicized because it's costing people's lives.
Yeah, I think that's you hit the nail on the head, and I wish we weren't in that situation and we had the right leadership, because it's going to cost a lot of people their lives at the end of the day. And I don't think those people are the politicians. I think should know better, and many of them do. And it's just ambition and chasing after a very, very small and declining base in the Republican Party. But I feel so bad for those voters and for those who are, I consider them victims of their own party in a way. They're being victimized and fed propaganda and lies about health. We see this not just in health, we see this in academia with, people who are just anti-intellectual. They're against anything from scientists, from academia. I mean, we see that with critical race theory in Florida now being the big boogeyman of the century.
Yeah, I you hit the nail on the head. When people don't want to get vaccinated, you can't force anyone to do something that they don't want to do, I'd say. So listen, when people tell me they don't want to get vaccinated, I'm like, okay, fine, but what are your reasons? And if they tell me reasons that are not based in truth, that are completely false or there's no data behind them, I feel bad, because I would rather have people make a decision based on information that is truthful and that is empowering to them. But when you are making decisions that other people have, effectively persuaded you to make because of lies and falsehoods, then you're essentially falling victim to things that are outside of your control, and that's really unfortunate.
Very, very. And I know we have some questions in the chat I'm going to bring up, and if you're watching up there, please add in your questions, and we'll definitely get them. So we do have a question here from Narnik Grant. It says, I have a question. Why aren't all medical professionals having the same message? It shows, let me make sure I can see this, this entire question here. It seems there is a great divide. I'll repeat that. I have a question. Why aren't all medical professionals having the same message? It seems there is a great divide.
Yeah, that's the question. So I would actually respond and say that most medical professionals actually do have the same message. Many doctors and nurses are on the same page, which is that getting vaccinated protects you from getting infected with COVID, hospitalized with COVID, dying from COVID. That's what the data shows. And that masking is actually extremely helpful. We've known about the importance of masking for decades. This is not new. So most medical professionals are on the same message. But what happens, and every industry has this, there are a couple of people who are going to disagree for whatever reason, right? And it's those people who disagree that the powers that be, people in the Republican Party, conservatives, latch on and then amplify their voices. And so what you have is a few people in a minority being co-opted to advance an agenda, and then it seems like there's two really big camps, when in fact there's only one camp and then a very, very, very small minority who are then amplified because it fits the agenda of one party. But rest assured, if you look at the medical journals that are sort of in charge of stewarding the world's medical knowledge, if you look at people, doctors across the country, the overwhelming agreements is that vaccines work and that masks work. And it's just a small few that are amplified and propagated.
Right.
But excellent question, because in this day and age, with the way that the media is set up, everything is A versus B, team versus my team versus your team. And so they want to find people who are going to counteract the prevailing thoughts in the medical community. And then it makes it seem like there's a divide. But I rest assured there is no divide. There's a consensus.
Right. A very small minority, but a very, very loud minority.
Exactly.
And, there are, people who I don't know what to consider them in the medical field who I don't know what the agenda is, if they're getting paid or I don't know why, what the issue is. I just don't understand, why you would put death and despair ahead of, it just has to be ambition or, I don't know what else causes someone to spread this level of misinformation intentionally. We have another question here in the chat with Narnik as well, and this is a good one. It says, what do you say to those who now use the booster shot as they're doubling down that the vaccine doesn't work? And for your information, I'm fully vaccinated.
Yeah, so the issue of booster shots is now going to become a bigger part of the conversation, as now there's new data showing that booster shots will most likely be required in the next couple of months. And so here's the breakdown. The way that the Pfizer and Moderna vaccines work is that everyone gets 2 shots, either 3 weeks or 4 weeks apart. Those clinical trial data was done last year, summer. And so those trials were done, and by the end of last year, the data came out that the vaccines were over 95% effective in clinical trials, and they were very safe, and that they protected people from getting sick with COVID. And then we started giving people vaccines in the real world. Now, this was always going to happen. When you give vaccines out to the population, scientists and physicians, epidemiologists, we're going to study how effective the vaccines are in the real world and for how long. And so because those studies were always happening, starting in January up to now and continuing, what scientists have now found is that the vaccines over time reduce in efficacy in preventing mild and moderate COVID infections. Now, the reason why that is one, the vaccine effectiveness does decrease in time. We know that about vaccines. That's just the truth. And 2, the Delta variant is just so infectious. It's so easily, it's so readily available to infect people that even fully vaccinated people have started to get test positive with COVID. That being said, the vaccines are still overwhelmingly effective in preventing serious COVID infections and death. And that is what we actually care about, preventing you from ending up in a hospital and having your life changed forever because of that. And so what these booster shots are, meant to do is get that decreasing immunity that happens over time back up. And a lot of childhood vaccinations have that same sort of schedule. You get 1 shot, you get 2 shots, and in a couple months later, you get that booster shot to boost your immunity and give you longer lasting protection. And so that's what what the booster shots are about. In terms of doubling down, it's not necessarily a doubling down, I would say. It's just sort of giving extra layer of protection. And it's not because the vaccines don't work, it's because over time, this is what happens. Immunity starts to decrease or wane.
Right. I will most certainly be getting that booster shot as soon as I could.
Yes.
I'm encouraging everyone to do that too. I'm young, and people will say you don't need it. You don't really need it, and I just want to do my part, because while I might have a stronger immune system, I'm still susceptible to this virus, and it's not about protecting just myself. It's about protecting other people who might be more at risk as well, and not giving the virus to them. And I encourage everyone to get vaccinated if you can, and if you have already, get the booster shot when it's ready for you. And we have got a couple questions coming in here. We have one here. Let me see. I don't see it on my screen here. Let me go back. Okay, so I think it'll load and it'll come in when it could. But I definitely want to get into the meat and the bones here to talk about some of the common myths exposed by the and by anti-vaxxers, as well as some like valid questions that people might have that they might just need some clarification on. And one of these being the first being, I don't want to get the vaccine because I don't trust the government. And I know you spoke about this earlier, and I'm definitely a person who isn't always trustful of the government. I will say that.
Is that why you're running to be in the government?
Right. That's why I'm running for office. I'm doing something about that too. But I just don't see, I understand where people are coming from, but I just don't see the evidence that, the government is playing around with the vaccine or is trying to, I hear people, one of the common conspiracy theories are, they're trying to track us or poison us or something. And I said, if that's the case, the politicians wouldn't be taking the vaccine themselves. I mean, they're definitely putting it in their arm too, some of them. So what do you say to people who say, they just don't trust the government and that's why they're not getting the vaccine?
Yeah, so I would say there's a lot of reasons to be distrustful of the United States government, especially if you're a person of color, because there's centuries of abuse there. I have a couple answers to this. So the first is that the number of agencies that are tasked with making sure that the vaccines are safe and efficacious, both in the United States government, but also around the world, are huge. And so within the US, you have the CDC, you have the FDA. Internationally, you have groups like the World Health Organization. In Europe, you have the European Medicines Agency. Japan has their own. There's actually government agencies and independent institutions whose job is to look over the data behind the vaccines and make sure that what you're giving people is not only safe but also works. And so trust that these vaccines are not in the sole purview of the United States government, but in fact places around the world, both governments and independent institutions, are doing their job to make sure that it's safe. And so that's number one. These vaccines are not a sole United States government peddled intervention. It's an intervention that is worldwide, and that places around the world are involved in making sure that their people are protected. And so that's number one. Number two is that these vaccines, when you think about it, were worked on and produced by individual scientists and doctors whose mission, the reason why they enter these fields, because they care about improving and making a positive impact in people's lives. And so at the very core of why these vaccines were produced is individual people, like scientists like Dr. Carrico and others, whose sole sort of mission is to advance science to improve human health and disease. And so again, this is not like the United States government working on these vaccines. In fact, it's scientists in labs in places around the country, both here and also abroad, doing this work. And then the third thing I'll say is that people need to trust in reality. And so if you really feel distrustful of what government may be doing, go out and see for yourself what the pandemic looks like in your county. In Florida, like you mentioned, over 300 people are dying every day. You go to hospitals, the beds are completely full. People are getting sick and taking off from work, not being able to go to school. Is this something that the United States government is creating for everybody around the country? The answer is no. This is actually what it means to be living in a pandemic. That is a reality. People dying is a reality. And so to protect from that, we have vaccines that are there to help, right? And so I tell people, trust in your reality, trust in what you see, and then trust in what can actually make that reality sort of better.
Right. And just to make sure, the vaccine is not causing autism, sterilization. They're not tracking us, and they're not killing
us. Correct. So the vaccines do not cause autism. No vaccine causes autism, but these vaccines definitely do not cause autism. That's number one. Number two, sterilization, no data whatsoever, untrue. The vaccines are safe. I've known people who've been vaccinated have subsequently become pregnant. Many of my medical school classmates who are now residents and doctors, absolutely. And then also, vaccines are incredibly safe for pregnant women and actually are quite protective. Pregnant women are at higher risk of getting really severe complications from COVID and dying. Actually, there was a story yesterday of a pregnant mom who was unvaccinated, and she and her unborn baby both passed. You know, that myth is also debunked. And then also vaccines tracking. I mean, if that technology existed, we would be, you know, 2 centuries in the future by now. So that is not the case.
And we are not going to glow all in the dark.
Absolutely no.
Some of the things I hear are funny. Some are sad. And, you know, I think, you know, with information, some people are likely to change their views on this. And then some people are just long gone. If they're already down that train so far, then there's, you know, nothing you can do. And some people hide behind, well, I have questions. And, you know, it's okay to have questions. That's totally fine. You know, at first, you know, I had questions, and I think that's okay. But then people, when you give them the information, the actual information, the truth, the facts, then they find another excuse. Like the FDA just fully approved the Pfizer, the vaccine. And, you know, now people are on to the next excuse. And, you know, it just shows that it's not really about the questions for, you know, many of those people. But for a lot of people, they have their questions. And I've seen people stray away from that and kind of come back to reality with the situation too.
Yeah.
And I know one of the common myths or common talking points I hear is people saying the CDC is misreporting COVID deaths or vaccine related deaths. I don't believe this, but I'm curious what you think people are talking about when they say that, or how they're interpreting that data that they're getting.
Yeah, when people say that, that is an attempt to alter or thwart the reality that exists on the ground. Because one way to dismiss vaccines and dismiss COVID is to say that it's not real, that the CDC is misreporting the data, that it's just not as serious as a problem, so that we don't need to take all these interventions. And my response is this. Number one, the CDC data is actually relying on states. Individual states have to report their data to the CDC. And so the CDC doesn't have that central organizing role. They direct states on what data to collect, but it's ultimately up to states. And each state is going to produce its own data. And so you have actually 50 different jurisdictions in charge of the data that is being produced. So that's one. And so people try to discredit the CDC by saying they're not collecting the information, when in fact, you have to look into each of the 50 different states and see what information is being sent. And that is important because you have states like Nebraska, states like Florida that have historically and are still ongoing messing up or not reporting the full data. So that's number one. Number two, the CDC is also not the only institution in the United States that's collecting data. Trust. There are universities, Johns Hopkins University, University of Washington, that are collecting data. You have governments, you have news organizations like the New York Times that are also independently collecting data. You also have international organizations like the World Health Organization that is collecting data. And so the CDC is not the sole voice in what the reality is here. You have multiple institutions collecting data, and they're all point to the same thing, which is that hundreds of thousands of people have died in the United States, and there's no getting away from that. These are people's brothers, sons, moms, daughters. These are real people. This is not a lie. And then two, that the vaccines are working, because we know who's getting sick, we know who's dying, and it's people who are largely unvaccinated. And so that is the reality. That is the situation on the ground. And I think we do a disservice to people by trying to sort of suggest that there's an alternate, there's alternative facts or alternative realities out there. In order to move forward and be productive and actually have solutions, you need to trust in what's actually in front of you first. So I say unequivocally that pandemic is real. Hundreds of thousands of people have died. The CDC, World Health Organization, New York Times, other institutions, Hopkins University, University of Washington, all of these institutions are collecting data and are pointing to the same reality.
Right. Absolutely. And, folks, if we really want to get back to the freedom that we all want, and, the freedom to live, which is what I want, the freedom to be able to work and not have to worry about the virus. If we really want to get back to the world, to a better world, I like to say, then we really need to get past this pandemic. And, I'm encouraging people, if we cannot get past this, we can never get that freedom back if, we allow ourselves to be led astray away from the science and away from the facts, and cause so much more unnecessary death and despair when we have the solution to this, which is getting the vaccine and doing our part to make sure that we keep each other safe, because this is not an individual thing. I know Governor DeSantis recently said, he cares about individual rights and the right of individuals to do what they want to do, and there be no restrictions on what they could do. And while that's all dandy and fine to believe, we will never be able to get to that if we can't get past this virus, if we can't get the shot. And, I heard someone say yesterday, which I thought was interesting and cool. They said they're not going to get the vaccine. And they said instead that they're going to, they stay home, though. They don't really leave their house or anything. And they wear a mask anytime they do leave. And I'm encouraging people, if you're not going to get the shot, and you should stay home, definitely keep wearing your mask. No one here can force you to get the shot. We can only really encourage you to do it because it's the right thing to do. But if you're not going to do it, I encourage you to really limit your interactions with the public and with other people, as you might be putting yourself and others at risk. But we can never get back to that freedom that we want if we can't even get past this simple thing where we actually have the solution to this right in our face.
100% agree.
Absolutely. And I know we have a few more common myths. I don't want to take up too much time with it, but
yeah, please.
The vaccine is not employed by Big Pharma. I'll just say that. And the other thing I hear is people saying the vaccine is unapproved by the FDA and therefore it is unsafe. Could you discuss the FDA's approval process, emergency use authorization versus what the regular approval process is for these drugs? Because I know that's a common talking point that I see people make in both the media, on certain media outlets, and on social media.
Right. So when the FDA emergency use authorized the Pfizer and Moderna vaccines back in December of 2020, those vaccines were authorized because in clinical trial data, they were shown to be incredibly safe, very effective, and there was a global public health emergency going on, which was the COVID-19 pandemic. And back in December, we were actually in our third wave. We're in the United States, over 3,000 people a day were dying from COVID. And so when FDA typically emergency use authorizes drugs, they do so because they have from early data that whatever intervention it be, whether a vaccine or a treatment, is safe, effective, and needs to be used right away in order to protect people's lives. And as soon as the vaccine started getting in people's arms, we got protection, especially amongst the most vulnerable in our population, those that are elderly and have other health conditions. And so that is what emergency use authorized medications are. That's the process by which the FDA actually, does that. It's for safe, effective drugs that actually need to be used in a public health emergency. Now, right, for any drug, the FDA is actually quite thorough, and then doing follow-up studies to ensure that right, the vaccines are continuing to be safe and are continuing to be effective. And that data actually takes months to collect. And so finally, the FDA had collected enough data from Pfizer to then say, okay, these vaccines are now totally approved, which for most people actually doesn't mean anything because you were still able to get the vaccine regardless. But what that tells us is that the FDA has looked at the data and there's an additional level of scrutiny to then show that, the vaccines continue to be safe and continue to be effective, and that they can now be used not only in a global public health emergency, but also, this is what the full authorization gives, can be used in other circumstances as well. The thing is, we're still in a global public health emergency. And so that distinction actually, for most people, doesn't really mean anything. But there are a lot of people who say they didn't want to take the vaccines because they weren't fully authorized. Now, at least Pfizer is fully authorized. And so we'll see whether or not that pushes people or whether more convincing needs to be done.
Yeah, sometimes I make fun of my friends who are also vaccinated, and they have Moderna and JJ, and I have Pfizer, and I tell them, go away from me. I'm the only approved vaccinated person. And that's the inside joke that we have.
But all these vaccines are going to be fully approved. The Moderna is coming down the pipeline soon. J&J a little later. So, but that's funny.
Our little inside joke. Me and my other friend call ourselves the approved vaccinated, and they're the in the pipeline to be approved vaccinated. I know we got a few more questions, but I want to get through a couple of these common myths and concerns that people have. One of the biggest things that I've heard on the internet, and a lot of this from people in the African American community, is that natural remedies alone can prevent COVID-19 or treat it. I wonder what your thoughts are on this, because there are a lot of people I know who have decided they're not going to get vaccinated because they believe, drinking certain types of things will prevent them from getting the vaccine or prevent them from getting COVID-19. What do you think about that?
Yeah, I really wish that were true, but unfortunately, it's not true. Now, when I tell folks, natural remedies are helpful in that if they make you feel better, if they give you more confidence, things like vitamin C tablets, zinc tablets, drinking ginger ale or lemon juice, all those sort of things are remedies that may make you feel better. And if feeling better is one of the things that you want to do, then I say go for it. But do not take these things if you think they're going to treat COVID, because there is no data whatsoever showing that they do. So that is my first point. The second point is that in medicine, we have these things called randomized control trials, or RCTs. That is the way that we identify which interventions, which drugs are actually effective. And so we take two groups, we take a group and we split them in two. We give one group drug or intervention and then another group placebo or nothing. And then we track the outcomes. And then we say, okay, in the group that got this drug or got this intervention, did they do better than people who did not? And a lot of these randomized control trials have been done for many drugs and many remedies out there. And we know which ones are effective and which ones are not. And things like natural remedies tend not to be, but they make people feel better, and feeling better is part of feeling healthy. And so that's why I would never tell people don't drink ginger ale if you have COVID, or do whatever remedy that makes you feel better, but know that it's making you mentally feel better, but physically you still need to get treated somehow.
That's a huge one. I want people to hear that. I know a lot of people who are going down there where they're saying, I'm not going to get COVID because I take my teaspoon of this and teaspoon of that, and I drink this, and I drink coconut water, and I do this. And I said, that's
my mom is the same way.
I hear you. It's a big issue, and I don't want people thinking that that's actually that means they're not going to get the virus. I know that's not the case. I know many healthy people who have used natural remedies and they still got sick, and some that have passed away, unfortunately, because of that. Because this is a virus. This is not like a regular flu or like a cold or anything. This is a virus, and the way to prevent or get rid of viruses are vaccines. That is actually a remedy we know that is proven to work and that is backed by science and data. So I want people to hear that part, that especially. Just a few more on here. The vaccine doesn't prevent you from getting COVID-19, so why take it? Only the elderly and those with pre-existing medical conditions get sick from COVID-19. That has been thoroughly debunked. So I don't even know if you want to say anything on that. But
yeah, I mean, I could, because I think there's some nuance still that is important to highlight. So number one, the vaccine actually does prevent people from getting COVID-19. That is the whole name of the game. That is what was shown in the clinical trials, and that is what we saw in data, not only from the United States, but in countries around the world too. So the vaccines do prevent people from getting COVID. Back when the trials were done, we didn't have the Delta variant. And so the Delta variant is the most infectious version of this virus that we have. It's so infectious that some people who are actually vaccinated do then get COVID. And this is what we call breakthrough infections. But the difference between getting a breakthrough infection, so someone who's vaccinated and gets infected, versus someone who's unvaccinated getting infected is huge. And so people who are unvaccinated and getting infected, a lot of them are ending up in a hospital because Delta or whatever variant they have completely, attacks their body. Whereas if you're vaccinated and you have a breakthrough infection, you have some level of immunity that your body is actually able to protect against the worst parts of the virus. And so people have mild to moderate infections. They feel like they have a really bad cold, which is very different from ending up in a hospital intubated, fighting for your life. And so the vaccines do prevent people from getting infected, but some people are having breakthrough infections, but those infections are mild to moderate as opposed to severe or leading to death.
Right. That's important. Very important for people to know. Just some quick ones. Hydroxychloroquine is helpful in treating COVID-19. No.
I laugh because that's former president's favorite drug. It does not work. So earlier I discussed about randomized control trials. There have been randomized control trials looking at whether or not hydroxychloroquine is actually effective. This data most recently came out earlier this year. And these trials showed that there's no benefit whatsoever in giving hydroxychloroquine to prevent COVID or to treat COVID or prevent against some of the secondary sort of ramifications of having COVID. So it doesn't work, unfortunately. Now, yeah, I mean, that's what I'll say there. Neither does ivermectin. So that's another drug that a lot of people are starting to peddle on the right. Ivermectin is a drug that we feed livestock to prevent them from getting infected with parasites. I don't know how this drug got so popular.
Yeah.
It doesn't work. And not only that, if you take lots of high doses of it, you can actually get sick, hurt your liver. So those are two drugs that are being peddled that have no benefit whatsoever. And masking and vaccines, many studies showing that there is a benefit.
Yeah, we are not horses, folks. So like the FDA said, do not play around with this stuff.
Absolutely.
And what do you think about, I mean, I know in Florida, our governor is telling people to take Regeneron, a drug, and one of his largest donors actually is running that show. So there's probably a lot more going on with that. But what do you think about that? I mean, that's the alternative people are saying now in Florida. Oh, take that instead of getting the vaccine. And it's kind of senseless to me.
Yeah, Regeneron is a drug. Oh, it's a company, but they make monoclonal antibodies, basically, which basically are molecules that help you fight infection. This treatment is very, very expensive. It is like too expensive to actually give millions of people in the United States, whereas the vaccines are relatively cheap. And so there's no guarantee whatsoever that if you get COVID, these medications are going to be offered to you. They're not even really authorized by insurance companies to pay for them unless you fit into a very specific type of patient in which these antibodies, this treatment is actually shown to be effective. And if you're in that camp, you get it. But we just don't have access to monoclonal antibodies. And if you go to the hospital and ask for it, chances are they're going to say no. And now you're just out of luck because you now have COVID and can't get treated. You know, politicians who are very rich and well connected can have access to that medication. People who are also quite really need it have access to that medication, but it's not something that the public has access to. And that could change, but right now it's just really cost prohibitive and also only works for infections that are just like not that bad, basically. So it also fits into it's like very specific who would benefit from it.
Right. Yeah. And kind of weird the governor is promoting that when he's in a state where most people are kind of struggling, and that just all weird all around. But let me see if we got any final questions here we could.
Yeah, we have some audience questions here.
Absolutely. We have some good ones here, and we have some crazy ones here. So let me look. Let's skip that. Nornique asks, what are the African American Doctors Association doing to get the message out to our people?
So the unfortunate thing about this pandemic response is that there's no real unified voice speaking to the country or communities about the vaccines and why they're effective. And so we are hearing lots of messages online from the media, from the TV. At the same time, you're hearing messages that are peddling lies about the vaccines all over. And so there's just a lot of this cacophony out there. There's a lot of voices and a lot of information that doesn't really feel unified. And to your point, African American doctors, there's no unified, there's no single person or two people that we can point to say they're speaking on authority. I will say there are a lot of organizations out there, national and also local here in Boston, and I know in other places too, where physicians of color are actually going into the communities and talking. And I can, one of them is We Got Us Project. You can Google that and look on the website. That is a group of healthcare professionals, Black and brown, who are speaking to our communities. And then if you go to the More Resources page there's a list of national organizations that are doing the same thing. So you're right, there's no unified message just because of the nature of the world that we live in right now. But there's a lot of work being done by Black doctors out there trying to get their communities vaccinated.
Absolutely. And I don't see any more questions. I see I know some of the questions from the different platforms did not come here to the stream. So
I see Mike Bente has a couple of questions. I don't know if you see that.
I see one here from 10:50 a.m. Well, let me go back to that says, why should let me just put it up here. Why should African American trust the government with this vaccine? Since when did they ever care about us?
Yeah, so 2 answers to this question. It's a good question. Number one, the clinical trials that were done to see if these vaccines work and are effective included people who were not only white, but also African American, Hispanic, Asian, and then also some international people as well. And so the racial makeup of these trials actually reflected the racial makeup of the United States. And this was deliberately done by the people running the trials so that they can go back and say, hey, we know that these vaccines work for all these different groups of people. And that is one way that you build trust, to show that you were actually included in the trials for the vaccines. So that's number one. Number two, if it's any constellation of people, the Moderna vaccine was actually, the science behind it was spearheaded by Dr. Kizzmekia Corbett, who is a Black female scientist who worked at the National Institutes of Health. And so you can look her up on social media, and her whole mantra, her whole sort of rallying cry is to get Black folks vaccinated. And she has spent her entire career working on coronaviruses and working on vaccines for coronaviruses. And she has put in the time and an effort to actually go into communities and say, hey, I was actually on the front lines when these vaccines were being developed. I was developing the vaccines. And so you can put your trust, perhaps not in the United States government, but in the scientists and physicians, people like myself, but others who have looked at the data, have really thought about what these vaccines do, and then are saying, hey, I made the decision to get vaccinated, and here's why I think you should too. And so perhaps you don't put your faith in the government, but you put your faith in the people who are actually on the ground doing work, looking at the data, doing analysis.
Absolutely. And let's see what we got here. Do we have some more? Do you want to take some more of these, or are you?
We can do maybe like one more.
Okay.
And then before you wrap up.
This one. There are no long-term studies on this vaccine. Why are you encouraging people to be? It's a common.
Oh, what a colorful question. Okay, so there are no long-term studies on the vaccines. Okay, so there are long-term studies on vaccines because we've been vaccinating people since the 1800s. And what we know is that any long-term side effects for vaccines tend to occur in the first, 8 days to like a couple of weeks. After that, there are really no long-term consequences of vaccinations. And we know that because we've been vaccinating people against many, many viruses and many bacteria. And so trust that when these vaccines were first given out to people in phase 1 clinical trials back in early last year, this was the number one question that they had in mind, right? Like, what are the consequences of getting vaccinated? And because no real consequences occurred, in the first couple of months, we are pretty confident in saying that there aren't going to be long-term consequences of this vaccines. Now, the question of why are we encouraging people to be guinea pigs, I would actually flip that and say it's the unvaccinated people who are actually guinea pigs at this point. They're the ones who are not being vaccinated and are now seeing the effects of what being unvaccinated is in a global pandemic. And so I would flip the script and say that it's the people who are signing up to be unprotected that are experiencing what it means to be in a society where a deadly virus is raging and you're unprotected.
Yeah, Mike, I hope you'll be able to, get to the facts and the information. I'd love to have a conversation with you too. So feel free to reach out and we can chat about this. No judgment. We'll chat. We'll keep it real, and we'll have a conversation about the vaccine, about COVID-19, and of course I'll try to convince you, but I'm not going to force you. But let's have that conversation. So reach out, send me a DM, and we'll definitely go from there. And I think we have no more questions here to take. I know some of the questions from the Facebook end did not come to the stream to be shown on the screen. So I will definitely send all of these questions in. So again, I say thank you, everyone. And now we just want to kind of go into the summary here and conclude the stream. So Doctor, what will be your message to people who are still on the line, who are not quite, against it, not quite for the vaccine yet, not quite sure whether or not they should get it, and they just want to wait to see what the effects are going to be?
Yeah, so first off, I'll say thank you for having me. I think you asked fantastic questions and your audience asked lovely questions as well. And I think my lasting message will be for people who are on the fence, people who are still deciding whether or not they want to be vaccinated. The most important thing you can do is ask questions and get information from trusted sources, from true sources, from sources that are making conclusions based on data. Because when you are informed with actual facts that are true, you are then making a decision that is based in reality and that is more empowering than being persuaded or being sort of hijinxed by lies and falsehoods. Because as we talked about earlier, people have agendas, and people will say what they want to say so that you are in line with their agenda, which may not necessarily be aligned with what's best for you. And so if you're on the fence, if you are still deciding, talk to your healthcare providers, go on the cdc.gov website, go and talk to people who have some expertise and get informed. And once you're informed, you are at least making a decision that you can rest comfortable knowing that it's based in reality and not in agendas that people are trying to peddle.
Absolutely. I definitely want to thank you again for coming on. I know it was pretty early in the morning and I kind of came out of nowhere to ask you to come on.
No. Thank you for having me, and I wish you luck on your campaign.
Yeah, thank you for sure. And I will definitely stay in touch, and I'll maybe one of these days I'll have you come back on if something changes or if there's much more. Absolutely.
Yeah. If there's anything that this pandemic has shown us is that change is something that we should expect. The situation is ongoing and evolving, and so we just have to continue having conversations with folks.
Absolutely. Well, I appreciate you again, and thank you for coming here.
Thank you.
All right, and I'm going to jump into showing you all the data again. Before I do that, feel free to make more comments. I'm going to be live for a little bit longer, and then I'm going to end the stream. But I definitely want you all to send in more comments that you might have. And while I do that, I'm going to share the COVID-19, the state of the COVID-19 here in Florida and across the nation. So let me just pull that back up for you all. And I'm going to try to get in the habit of doing daily COVID briefings. I think that's important, especially down here in our community where it might be, out of reach for people where they don't have that information. So I'm just waiting for my PowerPoint screen to resume, and then we'll get into this data. So we're going to do it from the beginning. Hopefully you all can see this. I think it's a little freezing up on me here a little bit. So, all right, so we're going to get back into this data. I want you all I'm going to start doing the daily COVID briefings every day. So we're going to get right into this data and break it down again. Again, this is current as of last night around 11:58, 11:59. I captured this data. So I'll probably be getting that data in the mornings, but this is where we are. And the data comes out every day. So global COVID-19 stats, we are seeing COVID-19 infections are still rising in the 78 countries. There have been at least 213.6 million reported incidents and 4.6 million reported deaths caused by the coronavirus so far. And as you see here on the screen, you see the new reported infections, the daily new infections. We are, as of yesterday, we were just over 600,000 new infections in the world. We also see here reported deaths. As of yesterday, we were around 10,000 reported deaths in the world. That's quite a bit of people from this virus when we have the vaccine. COVID-19 infections and death in the USA. This is here in our own country. Show you what is going on here. You see the new reported infections here in the US, 150,883. We are the first in the world reporting the most new infections for each day, averaging about 150,000. Iran is next. And then there's the United Kingdom, India, and Brazil. And these are just our averages here. And the reported deaths that we see here, about 10 in the US, about 1,104. Indonesia is number one with 1,177. So we're close to being number one in that respect. The state of Florida, we're going to talk about our state where we live and how this is affecting, our state. We live here and we see what's going on here and how this is really affecting us. There are 3.1 million cases in Florida, or there have been 3.1 million cases of this virus in Florida, 42,731 deaths to date in our state. There have also been about 309,000 cases in Broward County, Florida, which is where I am and where my district is. And a lot of those cases have been in House District 94, where I'm running. There have been averaging 20 to 30, excuse me, I'm kind of jumping the ship here, 3,079 deaths in Broward County total from the virus. That's been amazing. And we're averaging about 20 to 30,000 new infections per day in the state of Florida. That's a lot of cases. We are shooting up to the top. We are kind of becoming that epicenter of COVID-19, which is why I'm encouraging people, as many people as I can, to just get vaccinated. Let's try to bring these numbers down. And we have the solution to this, and the solution is to get vaccinated and get tested too. We encourage everyone to get tested too, so what's going on with yourself. And there have been 24.4 million doses given and about 11.1 million people fully vaccinated in the state of Florida. That's 51.9% of our population. We have about 21 million people, 21.8 million people in our country, not our country, excuse me, in our state, in the state of Florida, jumping the ship there. So that means there are about 10 million, almost 11 million people in our state that haven't been vaccinated yet. So, a big chunk of those are children who are not able to get vaccinated yet. So about 6 million, close to 7 million of those are adults who have not been vaccinated yet. So we're encouraging you to do that so that we could get out of this. Globally, the vaccination rates are 200 countries have begun vaccinating people for coronavirus and have administered at least 5 billion doses of the vaccine. That doesn't mean 5 billion people. That means 5 billion doses of the vaccine have been administered, which means that could be 2 billion people fully vaccinated. And a lot of this is in the global north. So we want to think about that and how that's being affected. A lot of countries across the world have not received the vaccine. So Gibraltar, I'm not sure how to pronounce this country, but Gibraltar leads the world and has administered enough vaccine doses for 117% of its population, assuming every person needs 2 doses. So that's where the globe is in terms of the vaccine, in terms of vaccination. In the United States today, with the vaccine, 364 million doses have been administered in the United States of America. About 171 million people have been fully vaccinated in the USA. About 279,000 people yesterday. 648,000 doses were given yesterday. That is about 52.2% of our population that's fully vaccinated, which means about 48.8% of our population has not been vaccinated yet. So we're encouraging you to do that. California leads the country in doses given, 47.4 million doses given, 21.8 million people fully vaccinated. That's 55.2% of their population. Texas next. And then here in Florida, 24.4 million doses given, 11.1 million people fully vaccinated, 51.9% of the population here in Florida has been fully vaccinated. So that's the data. That's where we are today in terms of COVID-19. And we are at the end of that slide there. So get back to here. I want to thank all of you for attending the stream, and I look forward to doing this a lot more often, doing a daily COVID briefing. This data is kind of scaring us. These graphs that I've just showed you are kind of scaring me because these numbers are a little too high or higher than they need to be. And I will say, that we must get through this virus if we want to return to some form of normalcy. We can never return to the world pre-COVID, but we can build a better world, and a better world that we can create is possible if we just do our part and we be smart and we get vaccinated. And if not, we wear a mask, or both. We wear a mask and get vaccinated. We continue with our social distancing and we doing our part. Masks are important. It's important that we beat this thing and we move away from it so that we can get our freedom back. I hear freedom a lot from people. If we want our freedom back, we need to lead the world in getting vaccinated. And that's the important part here. And we need to do that soon if we want to get our freedom back. If we want to walk in the world without wearing a mask, if we want to go back to work, if we want to do all of those important things and have fun and not have to worry about dying or getting sick, it's very important that we do our part in leading the world and leading the country with vaccinations. And I know we can here in the state of Florida. So I'm encouraging you, if you have not been able to get vaccinated, you should be able to do that by visiting vaccines.gov to find out where to get vaccinated. Again, that's vaccines.gov. You can also visit your state's website to figure out where that is. Most of your counties will have a list of places you can get vaccinated at. So I'm encouraging you, if you have not, to do that as well, to get vaccinated and find out where, if it's a walk-up site or drive-up site, you can get your doses. Remember, you have to get 2 shots of that for it to be effective. So let's do that. And then booster shots will be available for people too. So feel free to visit those websites and do your part in making sure that we get out of this virus. So again, I want to thank all of you for attending this stream and for engaging and having questions and dialogue with us. I know it's early in the morning, and some of you in California and other places have not waken up yet. So you will see this when you wake up. So thank you again for tuning in. And, I look forward to so much more. Thank you.